Welcome to the Bendino Podcast, where we're calling a spade a spade. Great to be here with you guys today. This Fauci situation has reached an entirely new level late yesterday. Fauci warning behind the scenes, alerting behind the scenes that the COVID vaccine could have some severe ramifications in terms of pregnancies, in terms of causing miscarriages. While he's out there in the public, while he's out there in front of the camera behind a microphone saying everything's all good, everything's all fine and dandy, it's safe, it's effective, nothing to worry about if you're pregnant, behind the scenes, he was busy saying, this could be an issue. Theoretically, this could definitely affect women's pregnancy. This can affect the unborn child. Let's get into it, shall we? Like the video, hype the video, let me know your thoughts in the comment section below, and subscribe to the channel. I would greatly appreciate it. Fauci privately warned of miscarriage risk linked to COVID vaccine while publicly claiming no issues. Newly released text shows. These texts, these diaries, it's showing what a conniving little rat this guy really is. What a conniving, fame-thirsty, clout-hungry, lying rat he really is. Let's take a look at the article. Fauci privately warned of miscarriage risk linked to COVID vaccine while publicly claiming no issues, newly released texts show. Dr. Anthony Fauci privately raised concerns that COVID-19 vaccine could theoretically be linked to miscarriages in expectant mothers, despite having publicly insisted there were no red flags for pregnant women. No red flags. I asked around a bit more, and another issue came up that you need to be aware of, wrote Fauci in a January 25th, 2021 text exchange with then Centers for Disease Control and Prevention Director Dr. Rochelle Walensky and Surgeon General Vivek Murthy. Since many people have significant cytokines, storm, and fever after the second dose, this theoretically could be associated with miscarriage in the first trimester, added the then National Institute of Allergy and Infectious Disease Director. Fauci, Walensky, and Murthy had been discussing whether the vaccine posed any risk to women who followed the two-shot regimen earlier or later in their pregnancies. Walensky responded to Fauci that the first trimester issues he raised were definitely a good point after dose 2, especially after dose 2. Days later, on February 3rd, Fauci said during a question and answer live stream with the Journal of the American Medical Association that the FDA found thus far, and we have to be careful, but thus far, no red flags about that, about pregnant women. So a few days prior, he's saying, if January 25th, he's saying the increased fever and the significant cytokine storm could theoretically be associated with the miscarriage. The response from Walensky was definitely a good point, especially after dose 2. And then about a week later, he says no red flags about that. Little rat. Months later, the Biden White House's chief medical advisor also said tens and tens and tens of thousands of women who have been followed by the CDC who have been vaccinated when they were pregnant, there's no indication whatsoever that there's any increase of any adverse issues in a pregnant woman who was vaccinated compared to a pregnant woman who wasn't vaccinated. It's pretty clear that pregnant women should get vaccinated. Other communications between Fauci, Murthy, and Walensky also showed them weighing the potential risks of vaccination against the risks posed SARS-CoV-2, the virus caused by COVID-19. Murthy also mentioned he was surprised to see World Health Organization put out a strong like saying they do not recommend Moderna in pregnant women. That's a strong statement to make and potentially quite damaging to public confidence among pregnant women, he told Fauci and Walensky in a text from January 26, 2021. Wow. Agree with Rochelle. This is from Fauci. Agree with Rochelle. There are no data or theoretical reason to believe that vaccinating or early versus later in pregnancy would be preferred. Yet some people, even female healthcare professionals, feel concerned about injecting a genetic vaccine very early in pregnancy. There is the misperception out there that we need to deal with that mRNA somehow can get into your genes. When the misperception gets extended to an early developing fetus, the anxiety heightens. I asked around a bit more, and another issue came up that you need to be aware of. This is what Dr. Fauci is saying. Since many people have significant cytokine storm and fever after the second dose, this theoretically could be associated with miscarriage. Dr. Fauci's messages right there in black and white. Wow. This guy pled the fifth 111 times. 111 times. Here we got the messages right here. But here he was warned again, February 8th, 2021. Tony, hope all is well. I wanted to alert you to some new data we generated with our nucleoside modified mRNA LNP vaccine. I attached a current version of a supplement request that has all of the new data. I've been working with a maternal fetal researcher, and we observed that using a dose of 100-fold higher than current vaccines and given IV, the mRNA LNPs go to the placenta and fetus, measured by translation of the mRNA, and cause an immune response in the amniotic fluid. In non-pregnant female mice, the uterus and ovaries take up mRNA LNPs and translate the mRNA. We are repeating these studies with human dose levels of mRNA given IM and are waiting to release the findings until these new studies are completed. I have spoken to the FDA, Moderna, Biotech, Pfizer, DARPA, who is doing a clinical trial with higher doses IV about these findings. I have also spoken to Mary Mariovich and Michael Penisori, our program officer for 2 clinical trials for HIV mRNA LNP vaccines. He will get us supplementary funding to investigate these findings. Thank you for doing the Rosenstein Award. 1 month after that text message, Fauci was warned by Dr. Drew Weissman, Nobel Prize for mRNA. We observed that mRNA LNPs go to the placenta and fetus and cause an immune response in the amniotic fluid. Wow. He was warned about it. He knew about it. Says nothing about it. Peter McCullough, James Thorpe, compared to influenza vaccination, COVID-19 shots were over 100 times more likely to result in fetal loss. This is study COVID-19 vaccines, the impact of pregnancy outcomes and menstrual function. James Thorpe, Clara Rogers, Michael Deskovich, so on and so forth. Data from open VAERS up to December 9th, 2022 demonstrated VAERS, Vaccine Adverse Event Reporting System. Wow. 4,070% miscarriage increases since the mRNA rollout. 5,229% deaths reported. 2020, 64 miscarriages and 420 deaths. 2021, 3,379 miscarriages and 21,959 deaths. 2022, 1,445 miscarriages and 11,829 deaths. This is absolutely insane. Dr. Fauci covering up per documents released by Rand Paul and Senator Ron Johnson. This deception was institutionalized in the now famous Shimbakuro study published on April 21st, 2021. In the digital version of the New England Journal of Medicine, the authors claimed a miscarriage rate of 12.6%, but the raw data revealed an 82% miscarriage rate in women vaccinated during the first trimester. This is consistent with the 81% miscarriage rate noted in the Pfizer post-market data. Wow. Piece of shit is right. What's going to happen? What's going to happen? Or is this all just being made no public so we all can just be laughed at and called fools for failing to hold this man accountable? Is anything going to happen? Yes or no? Let me know your thoughts in the comment section below. Like the video, subscribe to the channel. That means so much to me. See you next time, and as always, take it easy.